The World Obesity Foundation says death rates are almost always 10 times as great in countries where at least half the population is overweight. I asked Olivia Calancanti, the Director of Science and Programs at the World Obesity Foundation, to explain more.
In a way, it's not completely surprising to us because people with obesity are more vulnerable to respiratory illnesses. We have seen this with H1N1, with MERS, and people with obesity are more vulnerable to influenza.
What do you think governments around the world should do next, now that we know about this link between coronavirus and obesity?
We want governments to take a holistic approach and to adopt the ROOTS framework, which is recognize obesity as a disease, ensure obesity monitoring, obesity prevention, treatment for obesity, and a systems-based approach. That means that because obesity is such a complex problem, we need a coordinated solution that tackles it in all fronts. Just telling people to eat less and move more is not enough. It won't cut it.
Well, tell us more about that. I mean, as you know, the world's been bombarded with those messages for a generation. As you say, it doesn't work. The world is getting fatter. So we need blunter messaging, don't we? We need taxation on sugar in every country, for example.
We need different actions. So from a policy perspective, yes, we have seen that taxation on sugar-sweetened beverages work. We've seen this in Mexico, in Chile. From an overall perspective, we also need better and more specialized healthcare. We need doctors that know how to treat obesity. In most medical schools around the world, medical students don't even study obesity. And we need for people to understand that, again, this is not the product of lack of self-discipline or willpower. This is a disease. Obesity is a multifactorial, complex, and chronic disease, meaning that whoever suffers from it will suffer from for their whole lives. Only by truly understanding this, we're going to be able to have healthcare that don't have stigma or preconceived notions about it so they can help their patients. We can have media that, doesn't feed us this narrative, again, about personal responsibility. And we can have political action and regulation around food.
It's fashionable, though, isn't it, to blame governments and say this is the responsibility of big governments. Governments need to intervene and tell people how to live their lives. In the UK, there's the phrase, the nanny state. There is a responsibility on the individual to take personal responsibility, isn't there?
So I would say that in the obesity space, we actually see the opposite. The narrative really is about personal responsibility. If you look at the media, if you look at articles, images, the words that have been used, people truly believe that it's just because people don't want to get skinnier. They don't want to lose the weight or they're too lazy. In terms of government action, we live in a society and we are exposed to a certain number of things. And if we live in an obesogenic environment, it is the onus of the government to make sure that citizens are protected and they have access to healthy, affordable food. They have access to affordable health care. It has to be a joint effort.